Welcome to Lesson 4 of Learning the Language of Medications. My name is Ellen Jones. I am an Associate Professor of Pharmacy Practice and Board Certified Ambulatory Care Pharmacist. And this week we're going to be talking about the endocrine system and the gastrointestinal system. Our learning objectives are to recognize the major diabetes medication classes or families, learn the different types of insulin categories, which is based on how quickly they work and how long they work. Recognize the thyroid medications, our common GI medication classes, and then recognize those naming patterns. So there are 41 drugs this week, which is really a lot, I recognize, but if you can learn how to classify them into their classes and understand the naming conventions, it's going to go just fine. So we're going to learn about, like I said before, our diabetes meds, and there are multiple classes there. Our insulins, thyroid, acid suppression, nausea, and then constipation and diarrhea medications. You need to learn how to organize the medications into these classes. These are our diabetes classes. You're going to be seeing these a lot throughout your schooling and throughout your career. So the sooner you can lock these in, the easier it will be to build on this foundation. We have a biguanide, sulfonylureas, SGLT2 inhibitors, GL1 receptor agonists, DPP4 inhibitors, thiazolidine diones, and insulins. The first class we're going to talk about are our SGLT2 inhibitors. That stands for sodium glucose transfer 2. This is a receptor in your kidneys. So these work in your kidneys, and there are a couple more than this, but these three are on your list, and they all end in gliflozin. So we have canagliflozin or Invokana, dapagliflozin, Farxiga, and empagliflozin or Jardiance. And you're going to see GLs a lot because all of these diabetes medications work on glucose, and so they ended up putting GLs in a lot of these. So you do need to keep them straight. But the gliflozins, they work by helping you pee out excess sugar. So if you think about how it makes your pee flow out with the sugar in it, that's how you can remember the gliflozins. Next are our GLP-1 receptor agonists. You might also see them called GLP-1 agonists, or some people who should not, they like to just call them GLP-1s. That's an oversimplification, and that is not a really good habit to get into. So you can call them GLP-1 agonists, and they all end in glutide. Again, we have the GL, but they have a tide in them. So you can remember that these are, they also are indicated, some of these, for weight loss. So you can see here we have dulaglutide or Trulicity. Then we have semaglutide, which is Ozempic if it's being used for diabetes, and Wegovy if it is being used for weight loss or obesity. Then we have liraglutide is Victoza for diabetes, and Saxenda for weight loss. And then we have tirzepatide, which is a GLP-1 and GIP receptor agonist. So it works on two different receptors to lower blood sugar. And tirzepatide is Mounjaro when it's being used for diabetes, and Zepbound when it's being used for obesity. You've probably heard of these before. A lot of people are using them, and there's only going to be more. So you do need to pay really close attention to these. Next, we have our DPP4 inhibitors. These work on the same pathway as GLP-1 agonists, just in a different spot. These are oral medications, and they end in gliptin. So we have sitagliptin or Januvia and linagliptin or Tradjenta. We don't use these as often anymore because they are a little less effective than GLP-1 agonists. And so if we can do that, then we'll do that instead in most cases. These are our other classes. These are all just as important. We have the biguanide, which is metformin or glucophage. You can remember that one because gluco means sugar and phage means to eat. So if you think about it, eat sugar, which is not what it does, but it increases insulin sensitivity and also as has your liver, it causes your liver to produce less glucose on its own. Next, we have our sulfonylureas. These are the oldest class of medications, glimepiride or Amaryl and glipizide or glucotrol. We're really getting away from those these days because we have better options. These have a higher risk of causing low blood sugar, which can be dangerous, especially in elderly people. And then we have the thiazolidine or pioglitazone. This is another one it's not quite as popular anymore, but that's pioglitazone or Actos. Then we have our 4 different types of insulin, and it's based on how quickly they start to work and how long they last. So our rapid acting works very quickly. We have Aspart. The brand name for that is either Novolog or Fiasp, or we have Lispro, which is Humalog. Then we have short acting, which is just our regular insulin, which is the brand names Humulin R and Novolin R. Then we have our intermediate acting, which is NPH, which is Humulin N or Novolin N. So if you notice the Humulin and Novolin, if it's regular, it has an R in it. And if it's NPH, it has an N. And then we have our long acting, which is Glargine, and there's several brand names, Lantus, Basaglar, and Toujeo. Or we have Degludec, which brand name is Tresiba. Now, it is possible for someone, particularly with type 1 diabetes, to have a long acting and a rapid acting. So they would use a long acting once a day, and then they would use a rapid acting with meals. And those are our diabetes meds. And that was really fast. You're going to spend a lot more time on these in the future. Next, we have our thyroid medications. There are a few more than what are on the top 300 drug list, but the things you need to know for now are these are both just to treat hypothyroid, which is low thyroid. There are other medications that we use to treat hyperthyroid or overactive thyroid, but those are not on the list. But the one you need to know is levothyroxine or Synthroid. That is one of the most frequently prescribed medications in the US. And then we have desiccated thyroid, which is it's been around for a really long time. It's actually been around longer than before the FDA started approving medications. And it comes from pig thyroid. So that's, if you think about the way to remember it, Armour thyroid is Armour is also a brand of hot dogs. And this thyroid medication comes from pig thyroid. So those were our thyroid drugs. Now we go to our gastrointestinal drugs, and we have several classes here. We also, several of these are over-the-counter medications, so that you'll start seeing them in the community pharmacy over-the-counter. We'll learn about those in the spring a lot more. But our topics will be acid suppression, antiemetics. Emesis means to throw up. So antiemetic is going to be an anti-nausea and vomiting medication, and then constipation management and diarrhea. The first class are our proton pump inhibitors or PPIs, and they all end in prazole. So we have omeprazole or Prilosec, lansoprazole or Prevacid, esomeprazole or Nexium, and pantoprazole or Protonix. So these all work pretty much the same way. There's just a few finer points, but just getting these names correct is going to be really helpful. These work on the proton pump in your stomach. It's the very last step in the acid production, and they're quite effective. But the next class, which also works on this same pathway, is the H2 receptor antagonist. This H2 is a histamine, so it's a histamine receptor 2. You also have histamine receptor 1, histamine 1 receptors all over, and that's what most of our antihistamines are for, like a Benadryl or a cetirizine, something like that. But this is famotidine. It works on acid production in the stomach, and the brand name for that is Pepcid. Next, we have our antiemetics, and all of these pretty much have different mechanisms of action. They work very differently, but they all are used for nausea and vomiting. So we have meclizine or Antivert. There's another brand name, Bonine. You can get it over the counter. Then we have promethazine or Phenergan. Now, both of these are antihistamines, and they work on the anticholinergic system for the nausea. We also use promethazine or Phenergan in cough medicine. Next, we have metoclopramide or Reglan and ondansetron or Zofran. We'll get more into the actual mechanisms later. Also, you can learn all of these when you're working in Fluent in the app. And then we have a lot of different constipation treatments, and a lot of these have very different mechanisms of action and different indications. But just understand that all of these are used for constipation. So we have Docusate or Colace, that's a stool softener. Then we have linaclotide or Linzess, that is used for IBS, as is lubiprostone or Amitiza. Lactulose we use sometimes for constipation, but more often we use it for hepatic encephalopathy, which can happen for people who have liver failure. Ammonia builds up in their body, and lactulose helps to clear that. Then we have our polyethylene glycol or Miralax, which is another over-the-counter option. And then we have Bisacodyl or Dulcolax, also available over the counter. And then naloxegol or Movantic. That is a very specific constipation medication. It is specifically for opioid-induced constipation because all opioid medications can cause constipation. Then we have our anti-diarrheal meds. So this is the opposite issue. These stop diarrhea. So we have loperamide or Imodium. That's available over the counter. And then we have diphenoxylate with atropine or Lamodal. That is prescription only. Then we also have dicyclamine or Bentyl and sucralfate or Carafate. And that one we use for stomach ulcers because it acts kind of like a patch on a tire to protect the stomach from acid. So that is all of the meds. Our high yield naming patterns here, keeping these straight. The gliflozins are the SGLT2 inhibitors because of the flow of the urine. Glutide is the GLP-1 receptor agonists. The Tide goes with that. And then our gliptins are the DPP-4 inhibitors. That DPP-4 stands for dipeptidyl peptidase, which is just fun to say. And then we have our prezols, our proton pump inhibitors or PPIs. So I encourage you to spend some time in the custom deck that I created for these two topics, the GI and the endocrine. So do a few lessons every day on this week's content and go back and do the previous week's content because you know that the quiz will be pulling from everything we've had up until now. So practice your pronunciation in the app, the brand and generic names, being able to spell those, and then understanding what class a drug is in and the naming patterns. You can absolutely practice the mechanism of action. It's going to be a general overview level mechanism of action, but the sooner you can learn this stuff, the easier it will be to build on. So good luck this week, and I'll see you on the quiz.